Welcome everyone to another episode of Here Jaws Podiatry. We find ourselves in our little office-based surgical suite. We have a young patient who we originally presented. And this is the patient who had an injury, and at the level of the metatarsophalangeal joint, right? We'll make believe this is it right here. It's a really important joint. And he had injury to a very important ligament, one of them. So imagine, right, that there's a ligament on this side and then there's another ligament on this side. And it's kind of like a rubber band. You pull, I pull. You pull, I pull. Right? When there's two, the joint is perfect. It's functioning correctly. But the patient had an injury. So let's say this one was injured. So now this one, this is what's happening. Because this one's not there. Right? So not only is this happening, the toe, that's where you see the toe that's deviated this way, right? It's moving this way. So not only is it moving that way, this is how important the ligament is. Come this way. Let's show everyone from the front view. Let's go lower here, lower. There we go. There you go. That's the problem. The toe is overriding the great toe. So not only is it moving up, it's moving to the side. So today's procedure is we're going to do this. And you guys obviously don't know this, but right when I just did this, the tendon, right, the extensor tendon here, I felt it go click, which means that it's rubbing against bone, right? Again, right? That's quote unquote normal for him. So what we want to do is bring it right there. And that's exactly what we're going to do. People are always complaining that I don't show the procedure, the surgery. Maybe we'll go ahead and show a little bit of this.
Sure.
And then maybe you want to share it with your entire family over dinner. It's up to you.
Mm-hmm.
Post it. Whatever.
Okay.
Sounds good?
Sounds good.
So that's exactly what, once we do that, we realign that toe into the joint, right? Nice. Pain is gone. Is it that simple? It's that simple. One stitch. We're gonna go ahead and do that, so everyone stand by. Okay. So we're gonna go ahead and commence the procedure. Okay. This is a minimally invasive procedure that we're gonna do again, just to bring this toe down here. Okay. So let's go ahead and proceed. If you have any discomfort, please let me know, please. You okay?
Mm-hmm.
No pain, right?
Mm-hmm.
Okay. Pressure, right?
Mm-hmm.
So the first thing that we find ourselves here, anatomically speaking, is the tendon. You guys are gonna maybe hear it. Go crunch. Okay. That was the tendon. Try to tease it. Discomfort or pressure?
Just discomfort and pressure. That's it.
Would you like a little bit more anesthesia?
No, go ahead.
Okay. So what we basically do is there should be no pressure there, my friend.
Mm-mm.
Okay, good. So now what we do is we automatically, one second here. Again, there's no tourniquet. This is a wet procedure. And automatically we see that the toe has dropped. You see that? But now it's still moving this way. There's really not a lot to see, to be, and I feel bad for you guys because discomfort?
No, it's fine.
We're all done. We're done.
Excellent.
Come around. So, excuse me. Top view, second toe, rectus position. Rectus means straight. One little suture there. And again, I'm moving the great toe before this was on top of this. Number one. Please come around, Rosemary. And now, again, I'm doing this so you guys can actually see this is, weight bearing. The toe is not cocked up. See? Beautiful. So now, the key's splinting for a couple of weeks while the area heals, while everything heals. The patient, the worst part of the procedure was probably the numbing.
Yeah.
No one likes local anesthesia. It's a little bit uncomfortable. But nonetheless, patient walked in, he's going to be walking out. Next week, a couple, 3-4 days, take out that little stitch, and that's it. Patient can really, start, he'll take it easy. It's not that he's got to stay home, no. And again, the patient and myself were just talking about, our goal, our mission for a very long time, and will continue to be, what we like to call, we're here to educate the world one toe at a time or one foot at a time. And the most important thing is education, to let the people know, to let the world know that, that minimally invasive foot and ankle surgical techniques do exist. The patient, and you can actually say it, he went to see another doctor. Please, what did the other doctor say? What was his recommendation?
Oh, his recommendation was surgery, hospital stay, 4 to 5 inch gash starting from like the middle of the toe all the way down into the foot, possibly having to break the toe and then add bone.
Like a graft.
And then a steel rod that would go through it to hold it straight.
For a series, probably 4 to 6 weeks.
4 to 6 weeks,
right.
Yes.
So you take all that, right? You take all that, and then you take this, and we have achieved essentially the same outcome.
We have.
In 10-15 minutes?
Yeah. About, yeah.
Just about. So, and if some people are wondering, well, how is that possible? Why are these other doctors not doing what you're doing, Dr. Wagner, right? I can't answer that question. I really can't. But this foot looks
100% better.
right, and more importantly than anything, outcome. We have achieved the desired outcome. We have aligned once again the toe where it belongs. That's it. Relieving that pressure from the metatarsal head. The MIFAS Institute. I can continue to talk, but we're going to stop it right here before I get carried away. As always, www.jawspodiatry.com, Instagram, Dr. Toe Jam, Jaws Podiatry, Facebook, and last but not least, our YouTube channel, Jaws Healthcare. Again, The patient is already very familiar with splinting techniques, the most important part of all of these procedures that we perform. And he's going to be doing that for a couple weeks, but he's going to really do great.